Hi, everybody. This is Megan Barnett with BioLounge. I wanted to share our testing essentials. So these are the different laboratory tests and gadgets that we feel like we cannot live without at BioLounge. Okay, so let me give you a little bit of information about me. I have a bachelor's in dietetics. I went on to complete a master's in functional medicine and nutrition. So I work as a functional nutritionist at BioLounge, and also I'm the co-owner of the functional medicine clinic. And throughout the pandemic, I had a little time on my hands, and I was playing around with soluble fiber blends to see if I could move the needle with conditions that some of my patients were facing. And that was the origin of Fluorosophy, which is my other business, and that is a organic soluble fiber company. So I have different blends for different conditions. And then Ashley Kosh, the other functional nutritionist in my clinic, she and I developed the clinical immersion program. And that's our 12-week program at BioLounge that bridges the gap for clinical nutritionists between their education and their clinical practice. So it's also part of the American Nutrition Board certification for certified nutrition specialists. So we offer hours there, and then we have CNS supervision that follows. So that's a little background on me. So this is a great quote that I think really shines some light on what we all do as clinical nutritionists. By looking at only one place, you miss everything in all the other places. Look everywhere to see everything. And I think what we're about to dive into with regards to the testing that we use is one of the ways that we try to, kind of use our magnifying glass and look in all the nooks and crannies as they apply to different presentations. So for most of these tests, I'm going to tell you why you would want to run them. But this specific test, our comprehensive medical panel, we run on virtually everybody. So I think we see this as our foundational investigation. If a patient comes into our clinic and they have not seen a provider in the last year, or they've seen a provider and they haven't had a really comprehensive medical panel, we're going to order this just so we can get a baseline to look at any potential risk outside of lifestyle or nutrition, and make sure that we're referring out if we need to, make sure we're getting our own medical providers involved if we need to. So I've just listed some of the labs in our comprehensive medical panel. Some basics like the CBC with DIF, our metabolic panel. We do a pretty extensive iron panel looking at ferritin and transport proteins. There are some nutrients that we always look at for everybody: vitamin D, B12, zinc, copper, and magnesium. I like a plasma zinc and a red blood cell magnesium. Our panel always includes some hormones, and the hormones that are baseline are estradiol, testosterone, free testosterone, DHEA, sulfate, cortisol, and progesterone. Now, in some cases, we may check LSH and we may check prolactin, and there are some others, but that's going to be added only if we feel like the patient's presenting with symptoms associated. We're always going to look at glucose metabolism with an A1C, a fasting insulin, and triglycerides. So this is about half of the panel, and we have more tests that we have on our panel, but I have a PDF that I'm happy to send to you. If you just want to email us at learn@bioloungepdx.com, we will send you back a PDF that has every one of our medical labs listed out, which will be really easy for you to run through and decide if those are labs that are interesting to you, or if you want to add or subtract, etc. So again, in this situation, this is pretty much everybody. Everybody's going to get this panel, and we'll add on to it if we need to. One of the other panels that we use pretty regularly as nutritionists is an intracellular micronutrient panel. I know a lot of my colleagues use SpectraCell. We've landed on Vibrant, and I found this to be a very useful test. The reason that I like it is because I can see serum levels, so I can tell if somebody's getting these nutrients within their food. So we're looking at most of the vitamins and minerals, amino acids, and omega-3s and 6s. But I also want to see the concentration in their red and white blood cells. So I can see over a 3-month period, we're going to average the life of a white and red blood cell at 3 months. How well nourished are they? Kind of explain this to patients as their savings account. And it allows me to get an idea of if I need to supplement or if I can just make nutrition changes. And then if I'm supplementing, how aggressive do I need to be? So this is typically a test that we will retest 6 months later. So this is looking at white blood cell, red blood cell, and serum. And the reason that I might be triggered to do this is some of our patients just want to personalize their supplements. They feel like they're spending a lot of money on supplements and they want us to pare it down or make sure that what they are taking is actually doing what it says it's doing. The other reason that we use this a lot is we have a lot of patients that come in with symptoms that they don't totally understand. There's not a diagnosis. Their medical panel looks fine. So there aren't any arrows pointing in any directions. And we want to make sure that we're supporting all of their biochemical pathways. So that may be another reason. We have athletes or even like teen athletes that are looking to optimize their performance. This is appropriate for executives as well that are wanting to optimize their work performance. It doesn't have to be athletic performance. And then we actually work with a population that's preparing for procedures or surgeries. We do this a lot with oral health providers that are doing things like extractions. So we want to make sure that they're shored up and ready to deal with the stress on their body. So vibrant food sensitivities is a staple in our clinic. And the reason that we're using this oftentimes is because we are working with a population of people commonly that come in with symptoms that are, they kind of seem random, right? So they may be experiencing psoriasis and they have constipation and they have chronic pain and maybe they have some nerve symptoms. And so what we're aiming to do is turn down the dial on inflammation, period. And we're using this test to identify foods that are triggering an IgG and or IgA response. Now, what I like about Vibrant specifically and why we're pretty loyal to this test is because we have custom panels with them that look at Zoomers, which is their name for their peptide testing. So when we're looking at an immune response to the total protein, it's less sensitive than looking at an immune response to the peptides within the total protein of food. So in our food panels, most of them include the peptides within wheat, egg, dairy, soy, lectins, and nuts. And then we have, and corn, and then we have some other panels that we've parsed that down a little bit. And then we do look at 200 additional foods that we're just looking at the total protein response. But, you know, kind of by proxy, if we see an IgG response or we see an IgA response, our experience is that when those foods come out, I kind of think of it as like I've just taken the dial on the stereo and turning it down on inflammation. And so it's not necessarily that the foods are the problem, but they are a tool to reduce inflammation. If we're seeing IgA responses, we're thinking about reducing the inflammation on the actual gut lining. And then Vibrance panel also looks at antibodies against lipopolysaccharide in the bloodstream. And I find that really helpful for identifying more severe cases of intestinal permeability. So some of the reasons we run this test would be chronic pain. We see skin, hair, and nail manifestations. Sometimes there's digestive issues, not always. Poor absorption. So we'll see, you know, kind of failure to grow in children sometimes when they have major food sensitivities. We use this for people experiencing cognitive symptoms, and that may be cognitive decline, but it may also be attention deficit disorder, it might be depression, maybe anxiety, et cetera, and hormone imbalance, just to name some of the reasons. And then I mentioned the growth and developmental delays. We do see that in kiddos fairly commonly. Okay, so Para-Wellness is a stool test that we use really, really regularly in our clinic. This is a company out of Colorado. It is run by a gentleman named Dr. D'Angelo. He's an MD and he is a parasitologist and probably the leading expert in parasites in the US. Um, I kind of laugh a little bit about this test because it's a very mom and pop test. But to really identify a parasite, you need to look under a microscope because PCR testing doesn't really work. And you need to look at multiple slides. So if you were to go to your gastroenterologist and they took a slide or they took a sample and they sent it off to Quest, for instance, or one of the other standard labs, oftentimes they're going to look at one slide. And the problem with parasites is that they're kind of evasive. So you may find it in one sample, but you won't find it in the other. And so one of the things I really like about this test is that they look at many slides. And the eyeballs looking through the microscope actually matter. This is not a machine identified test. This is something where we need really skilled eyes looking for really teeny tiny things. And so we've had really, really strong results with sending our stool tests through Parawellness Research and Dr. D'Angelo. So it's testing for parasites and yeast. That's it. Why would I do this? So diarrhea is extremely common. IBS diarrhea, the great majority of the time that we have a patient with IBS diarrhea, they have giardia. It is not uncommon. You do not have to go out of the country to get it. You don't have to drink out of streams to get it. You can get it from your dog. It is ubiquitous in the Portland metro area, and it is something we see very regularly. We also see parasites associated with constipation, but oftentimes that's actually a manifestation of yeast overgrowth. Yeast overgrowth can lead to histamine symptoms, skin irritation, hives, psoriasis, eczema, and symptoms of mast cell activation syndrome. That's because the manifestation of yeast trigger the release of histamine from mast cells in the intestines. Sometimes we'll see GERD or acid reflux. And then yeast is also really associated with insomnia and anxiety. So this is our staple when we're dealing with any of these symptoms and when we're suspicious of a yeast overgrowth or parasites. Okay, so Dutch test is also a test that I use fairly regularly, dried urine and saliva hormone testing. I like this test because it collects multiple times in one day. I do a lot of work with the detoxification of estrogens and prevention of breast cancer and other hormone-related diseases. So I find this to be extremely helpful from a preventative perspective, but also if you're trying to figure out what the heck is going on with your ladies. I don't use this as often in menopause because you're generally going to see low levels of almost everything, and you can see that in a blood test. It's typically pretty common if they're not detoxifying, but I do find this to be really helpful throughout the childbearing years. For menstrual symptoms, for menopausal symptoms, so this is before the person's gone all the way through menopause, fertility, detoxification. So how concerned do I need to be about detoxification? If I'm concerned about detoxification of hormones, I'm also concerned about detoxification of other toxins. And then one of the reasons that I like this test so much is because when we look at the metabolites, we can identify more acutely the nutrition, supplement, and lifestyle interventions that will push the pathways. So I really like Dutch's pathway page, I guess. It's their schematic of the different pathways of the hormones. And then within that schematic, they show what the research tells us we can do to push the pathway one way or push the pathway the other way. So this is one that we use fairly regularly when we're dealing with issues. It's also a nice one to be able to then go back and rerun in maybe 6 months or so to make sure that you've moved the needle appropriately. Okay, so there's a bajillion stool tests on the market. We've used many of them. There are arguments around the sensitivity and specificity of many of these, and also the validity of them when they're tested or not tested by a third party. The reason that I've landed on Genova after all these years is because they're validated by the Mayo Clinic. Um, I really like that I have the option of adding culture to and microscope testing to this test if I feel like we need to do a deeper dive on certain things, such as yeast or H. pylori or other bacterial infections. Um, it's a nice overview with the microbiome. It gives me some ideas about digestion, if they're actually breaking down and absorbing their food. Um, I like looking at this for beta glucuronidase if we're seeing hormone issues. Um, and then obviously I'm looking for infections. And what may trigger me to use Genova is any of the digestive symptoms that we spoke about before: constipation, diarrhea, heartburn, etc. Um, if there's pain in the digestive tract or pain anywhere that's also associated with some of these other symptoms, or if there's blood or mucus in the stool, I'm going to be thinking about this test. And then if I'm concerned about any type of infection. So I get concerned about infection when there are GI symptoms, but also when there are skin symptoms, oftentimes when there's chronic pain or chronic fatigue in tandem with GI symptoms. Um, so that's when I may pull out the GI effects. Okay, we also use Vibrant's toxic burden panel, and this is a urine test, and it looks for environmental pollutants and toxins. It looks for heavy metals, and then it looks for mycotoxins. So obviously, when we're concerned about mold issues, this can be helpful to see if there's mycotoxins circulating. This is a test that we use a lot when there are, again, mystery symptoms. So the patient comes in, they have maybe a wide variety of symptoms in different systems of their body, and there's not a good explanation for why. Sometimes this develops slowly over time. Sometimes it comes out of the blue, and we see this with ADD, ADHD, especially in kids. So this is a test we use a lot in little kids because it's super easy. It's urine. And so when they're struggling with, when they're neurodivergent, when they're struggling with attention in school, when they're having skin issues, when we see they're sometimes resistant to eating certain foods, it can be a toxic burden. Depression, anxiety, definitely with cognitive decline, we're looking at this. And then one thing I didn't mention is hormone symptoms and infertility. That's another thing that we're really thinking about here. If you're working with a population of women that are in childbearing years and they are thinking about conception, if they've already had a child and now they're getting ready for another child, understanding their toxic burden and helping them detoxify before they're giving birth and breastfeeding is really, really powerful to prevent childhood diseases and neurodivergency. Okay, so this is a test that I personally run a fair amount, and I think it's one of the less popular tests among functional medicine providers and with Vibrant. And this is the Candida and IBS panel. It used to be called the fungal antibody panel. So it's a blood test that looks for antibodies against fungus, and it's many Candida fungal infections, but it's also other fungus that we see less often and sometimes can be an exposure from water damaged buildings, et cetera. And then antibodies associated with IBS. So we're looking at antibodies that would indicate that the immune system is attacking the colon, not calprotectin. You know, it's kind of different profile. But this comes up for me if I'm suspicious that the person has Candida overgrowth in their GI tract. Yes, but I'm looking at whether or not that Candida has translocated into the bloodstream and triggered an immune response. And the reason this is important in my practice is because oftentimes I'm coordinating care with a medical provider and I'm talking to them about prescribing things like fluconazole and nystatin while I'm making nutrition and supplemental programs for the patient to rebalance their gut, to heal the intestinal lining, et cetera, et cetera. And I want to be able to advise the provider Do we really need to use fluconazole? Do we need to go to a systemic drug, or can we use nice statin or something that's localized to the GI tract? I'm going to be more suspicious that we have translocation of fungus into the bloodstream and a systemic inflammatory response if they have chronic pain. Musculoskeletal pain is a really common manifestation of this because candida will trigger an immune response, yes. So you have all the inflammatory molecules, but candida, as it metabolizes, excretes acetaldehyde, which is a cellular toxin. So you're normally going to get an increase in IgE, so histamine responses from yeast, especially in the GI tract. And then secondary to that, you're going to have an increase in inflammation and toxicity to the cell. So fatigue will be a big part of that, anxiety, insomnia. I wrote chronic pain twice. I meant chronic fatigue. Sorry about that. Cognitive decline is very common. We get concerned that the candida has crossed the blood-brain barrier in cognitive decline when we see the candida antibodies come back positive in the bloodstream. And then also IBS. Okay, this is not a test, but I did want to include it because when we're measuring data for our patients, one of the other tools that we're using really regularly is the continuous glucose monitor. We will use this with people that are resistant to weight loss. They're really struggling or they have food addiction. It's fun for them to see their blood sugar responses in real time, and that real time data tends to change behavior more effectively than testing an A1C and a fasting glucose every 3 months. This is phenomenal for cognitive decline when we're trying to keep them within an optimal range, often between like 60 and 90, to reduce inflammation in the brain. Hormone imbalance, it's essential for hormone imbalance when the other things aren't working. Chronic fatigue and low energy, that classic afternoon fatigue, and then sleep apnea when we're, and I should say fatty liver as well. So when we're really trying to turn back some of these diagnoses, and we can give that person that feedback where they're watching themselves and they're learning every single time they spike out of the range that's optimal. And when they get that narrowed down, then their body is going to tap into those fat stores and triglyceride stores. So this is a tool we use a lot. I really find it to be helpful. It's very engaging for our patients, and it gives us an opportunity to educate them and empower them to make decisions around their food that keep moving the needle for them with their health. Okay, so those are our essentials. There's a lot of other tests on the market. There are other tests that we have used that we don't use anymore because we haven't found them to be helpful, or because we found tests we think are better validated. There are tests that we use, but we use them so seldom that they didn't make the list. But these are the tests that pop up most commonly in our clinic. And again, I would love to share the full medical panel with you if you're interested. Just email us at learn@bioLoungePDX.com. If this is interesting to you, and if you feel like you want to learn more about how we have applied our education in clinical practice, we have a couple of other ways that you can become engaged with us. You can sign up for our newsletter, The Clinical Insider, which is really fun because we send out case studies every few weeks about the patients we're working with and what results we've had. We have our clinical immersion program, which we run 2 times a year. It's a 12-week program, and you can learn more about that at learn.bioloungepdx.com. And then year-round, I run a CNS supervision program. So if you want more information about that, please reach out to me directly at megan@bioLoungePDX.com. Okay, so this is the first in a series of 3 webinars. Keep your eyes peeled for the next 2, and I look forward to connecting with you at some point.